Can I do surgery for bent penis? Now, if I'm a patient and I have a bent penis, I will be technically very worried. I will be psychologically disturbed because I am constantly worried about my partner judging me on my bent penis. So many patients who present to the clinic with bent penis usually have a deviation or penile deviation ranging from about 10 degree to 30 degree. Now, this is physiological. A large proportion of patients will have only physiological bent penis, which is not technically a disease. Now, in some patients, the bent deviation or the penile angle deviation will be more than 50 degree and 60 degree. There, we must rule out Peyronie's disease. And I've frequently said this in a lot of videos. But can you do surgery for it? Can you surgically correct a bent penis? And the answer is it's not about whether you can do. You should not do it. Because always remember, with bent penis, when you surgically go and correct, or when patients, go to a urologist or andrologist and they want to surgically correct the bent penis, cuts are placed in the side opposite to the bend. That is, there are different surgical techniques. So if the bend is like this, a cut will be placed in the opposite direction and the cuts will be deeper in the cavernosa, and then the angle corrects like this. But the problem is, once you do the surgery, patients invariably develop what's called as erectile dysfunction. Because with any penile surgery, right, even if you do for bent penis or size enlargement, there is a real risk of erectile dysfunction developing. So should you do the surgery in such cases is the question. Is it worth the risk? I would say no. Don't ever go for bent penis surgical correction. Remember, 10 to 20 degree, 10 to 30 degree will not affect your sexual life. It will not affect the quality of intimacy that you have with your partner. Yes, if you have Peyronie's disease, if you have a major bend like 50 degrees, 60 degrees, yes, you cannot penetrate into the female vagina. That's a problem. There the story is different. Again, for Peyronie's disease, we generally don't do surgery. Clostridium histolyticum, so botulinum toxin injections are usually given into the Peyronie plaque, and then the plaque size is reduced. It's done with the help of an interventional radiologist, and that's the first primary line of management, right, for Peyronie's. Surgery in the penile tissue should generally be avoided at all costs. So this is just a heads up video to keep you warned and informed that please don't do any surgery if you find your organ is bent. Just leave it at that. The 10 to 30 degree bend is not really a problem. Hope you like the video. Comment, subscribe, and subscription. Keep watching this channel. See you soon with many more videos. This is Dr. Shahs.